Joining me with what's being done at one San Diego hospital to improve understanding, offer support, help kids, teens, and families dealing with gender identity are my guests, Dr. Ron Newfield and Dr. Maya Marinkovich with Rady Children's Gender Management Clinic. And Dr. Marinkovich, when did this gender management clinic actually start, and what led to the opening?
We had seen some patients sporadically prior to 2012, but in mid-2012 our clinic has become more official. And since that time we have experienced increased number of referrals, and to date we have seen over 80 new patients in our clinic.
What is transgender? What do we know about it?
Transgender or gender dysphoria, well, I should say first, transgender is a very broad term that includes people who are not congruent with their assigned or natal gender.
So what they were born with?
Correct, what they were born with. And gender dysphoria is a state of typically depression, anxiety, and dysphoria that in some cases is accompanied with the gender non-congruence, particularly if care is not available.
And Dr. Newfield, how old are the kids and teens that you typically see, and what do they tell you about how they feel about their biological gender?
Most of the children that do come to us as teenagers and adolescents, although we do have some children that come at a very young age, sometime in elementary school, but the majority are in their teen and adolescence, and most of them come after many years of inner struggle, sometimes knowing that something is not right, sometimes not being able to quite figure out what is different about them. And oftentimes parents will think they might be gay or think that they're just a phase that's going to pass, and then they realize that this is something that is there. And for a lot of them, they really just feel very uncomfortable in the body that they were born. I mean, they'll express that very vocally sometimes.
When they come in, if you would walk us through the work that you do at the clinic there, what kind of evaluations and services do you offer?
What we hope to see is that when the patients do come to our clinic, that they've at least seen already some therapist. And in the majority of the cases, that's indeed the case, so that they've already seen a therapist, whether it's for depression or cutting, self-harming themselves, or actually discussing already their feeling that they're transgender. But sometimes we have patients that come to us without actually having seen any therapist, and part of our role is really to direct them to the right people that can help them. In general, not just in Rady, worldwide, the guidelines from the Endocrine Society and from other bodies in the world define our role not as the one making the diagnosis of somebody that is or is not transgender. It's really for experienced mental health providers, and it requires a few sessions at least to get a good full evaluation. And that's our role, really, to make sure that they get that.
So once they're evaluated, Dr. Marinkovich, do you also address some of the physical changes, let's say a teen or a young child needs to cope with?
That depends on the age of the patient. If the patient comes to our clinic at earlier stage of puberty, we can certainly, with parental consent, provide medication to stop development of unwanted puberty.
So hormones?
These are actually called puberty blockers.
I see.
These are hormones that are used commonly in endocrine practice for other conditions. So they are used in these cases to halt the puberty and allow time for this patient to continue through therapy and to make sure that this is not a phase.
Yeah, and that brings me to a question for you, Dr. Newfield. What about, how do parents know if this is a phase or not, if it's just a stage, or if there's something really going on as far as gender identity?
I think there are two periods that we know developmentally. Gender identity starts in a lot of children at a very young age, so before they enter elementary school. But for some of them, it's not something that is so clear in their mind, and we are living in a binary society. So even if they're feeling different, sometimes they will feel that at a young age and then will suppress that. And there are two age groups that we see that present. The one that present very early in their early childhood are those that sometimes it will be a phase, and somebody that was born a male would want to play with girls' toys just because he has an older sister. And that may very well be a phase. But for some of these people, it's very, very clear that it is not a phase, and especially when they present in their teen and adolescent years. So we know from the literature, and the Dutch have had a lot of experience for many decades, that when you're already presenting as an adolescent, it's rarely ever a phase.
All right. Well, Dr. Marinkovich and Dr. Newfield, thank you very much.
Our pleasure.
Thank you
Thank
very
you.
much.